Well, welcome everybody. My name is Dan Check. I'm a Vice President of Insights at KLAS. This is my colleague Adam Charrington. He's Vice President of Digital Health. We've done some exciting patient engagement, patient-focused research, I should say, that we're excited to share with you today. Got a small group, but if you have any questions along the way, would love you to interrupt and ask. We want this to be a dynamic discussion. I'll do most of the talking. Adam's been speaking all week, and he's got a little bit of a sore throat. So if you have, make sure all the questions go to Adam, all the tough ones, all the easy ones you can direct my way. So I want to walk through a little bit of a history lesson of KLAS's patient-focused research. So this is a study, a white paper that we published at the beginning of 2020. So you think about where we were at the time. This was right ahead of the pandemic. And we had just held a summit on patient engagement technology with vendor executives, provider executives, and the voice of the patient was in the room as well. And our goal was to walk away from that meeting with a model for what should patient engagement be. It can be a lot of things, but if an organization were to walk away with some marching orders of what they should invest in for patient engagement, we wanted that to be an outcome of this summit. So we wrote this white paper after the summit and came out with a model of patient engagement technology and how you should approach it. After this summit, we took the areas in that model and we went and asked the industry. So you can see three different dots on this. The orange dot is what patients cared the most about. What were they wanting their vendors to deliver and the providers to invest in to create a great experience for them? The blue dot is what provider organizations were investing in. And then the gray dot is where vendors were developing. So we took the three different data sources and kind of mapped them together so we could see where's the industry aligned and where are they misaligned. Yeah, and this patient data was actually from a very quick social media blast. This was just a few hundred patient responses, and it told us some really interesting things. But we kind of left this study with a hunger to go understand the patient a little bit deeper, and that's what led us to some research I want to share. What's really interesting, if you look at this data, what are the things that the patients are caring most about? These are some of the top patient priorities, and we've got them listed down here, what some of those capabilities are. You've got things like, I want to schedule my own appointment. I want to find a doctor when I come to a website. I want to pay my bill online. These little simple things that we experience in so many other industries with relatively little friction, patients want to be able to do that and have that same experience in healthcare. So you'll see these things that are the highest priorities for patients. When we went and asked the providers what were they investing in and what technologies they were taking advantage of, those same capabilities are some of the lowest, at the time, were some of the lowest investment areas for provider organizations. So you look at, and again, this is actually in the middle of the pandemic, so telemedicine had exploded at this point. If we'd done this survey right at the beginning of 2020, I would have anticipated a lot lower usage. Less than half of the industry was doing self-scheduling at the time. So you start to see some trends that we were seeing. Patient priorities were not necessarily aligned with vendor development and with provider energy. So fast forward, 2022, end of 2021, we partnered with Phreesia to measure patients as they were going through the intake process. We tacked on a little survey at the end of that process, and over the course of a few weeks, we were able to gather just shy of 13,000 patient responses. So you can see we took an N of 200 all the way up to near 13,000, and we wrote another white paper to see how the industry had progressed a little bit. So terminology is a little bit different on the left, but same idea. Orange is the patient, blue is the provider, and gray is the vendor. And what I want to point out is you'll notice there are a few areas where the industry is relatively well aligned, where patient priorities are well aligned with where providers are investing and vendors are developing. But then you have some areas of quite a big disconnect. Like you look down here, getting educational information. Now that may not be the highest priority for a patient. These are all relative. So this doesn't mean nobody cares about engaging their family in their care, but when they look at the priority of that compared to scheduling their own appointment, they want to schedule the appointment. That's more of an acute issue for them. But look at educational information. A lot of vendor development for that capability. There's a lot of companies that create educational content, that deliver educational content. In the mind of the patient, they just want that content. They want it delivered in a way that's consumable, a way that they can digest and can understand. It's likely not the best time to deliver that education to the patient right as they're coming out of anesthesia, for example. And then there are some areas where the industry's lagging a little bit. These two areas where the patients are really focused, self-scheduling and checking in for their appointment, are areas where there's a more moderate interest from the vendor and provider community. Any questions on this chart or this model before I move on?
Well, it's really apples.
Yeah. Absolutely. Exactly. I mean, you look at these two areas right here, they're compliance, right? Absolutely. Yep.
I'll try. Education is a great example of that. The content there is to protect or be compliant generally. And so as a patient, what do we do with that information? It's too generic. It's too long. It comes on paper often. Not always. There's a lot of happy exceptions to that, but you said it exactly right. And that's part of the point of this, that we don't think of the patient's perspective enough. And so we believe if you focus on the patient, you're going to meet some of those objectives anyway. Make it easy to schedule. They're going to show up. Your no-show rates should improve. If I schedule my own appointment, I'm going to go because I scheduled it. It's mine. So that might be as much as I get out today.
I think a great data point that illustrates what Adam was just talking about. You look at communicating with the office before the visit. This is the top priority for patients, for providers and for vendors. And what's driving that? They want no-show rates reduced. They want to keep people coming to their appointments and keeping those slots filled because that brings in revenue for the organization. What does a patient want? It's very interesting. You watch the news over the last year, the high volume many organizations are dealing with of patient communication requests to their provider, and some organizations have started to charge for that. I think it's a really interesting dilemma organizations are in. Patients obviously are wanting to communicate with their provider, communicate with the organization. How do you divert those the right way? How do you triage? If a patient responds to a message that just says thank you, can you pull that out of the physician's workflow so it isn't creating additional burden for them? Okay, so this is 2 years back. This was the mini HIMSS in Las Vegas. Adam attended a presentation, an education session in that meeting, and this slide was up, and he immediately took a screenshot and sent it to me because we're so passionate about this. This was from Providence. Patient expectations don't necessarily equal hospital expectations, and we see that. That's what we're seeing in the data and showing you here. For those Kevin Hart fans, this is our message. This is what we preach. Okay, so I want to walk you through a little bit of the data from this study. Again, just shy of 13,000 patients participated. And one of the questions that we asked is, outside of the care that you receive, what are the significant factors that cause you to choose your healthcare provider and where you choose to receive care? There's a few things up here at the top of the chart that you can't necessarily control. You're not going to move your doctor's office as you consider how to attract patients. So convenience plays a large part in where they choose to receive their care. But you look at this whole middle group. We call these the digital access tools that patients were bringing up as significant factors in where they choose to receive care. And put yourself in the mindset of the patient. A few things like ability to know the cost of care. We actually saw this very high for younger responses in this, or younger respondents in this survey. The ones that are coming out of college, they're strapped with debt, they may be in a high deductible plan and not have a well-paying job. So they really want to know, what am I going to pay for this appointment before I show up, right? That communication that we talked about, online communication with the staff. They want more than just the tactical appointment reminder. They really want a dialogue with their physician. And we obviously have to make sure the organizations are compensated for that, but that's the desire that they have. And then obviously the recommendations, the word of mouth carries a pretty significant weight as well. But when we share this message, it's really this middle group where we feel there's a big opportunity. If organizations can nail the digital experience with patients, when they start to have more of a ability to choose, as their insurance company may give them 2 or 3 choices, they're going to start to go to organizations that create that type of experience for them. Amazon? Oh yeah. So we were just at an event about 6 weeks ago, and there was a panel about some of the new entrants into healthcare that are shaking things up. Walmart, CVS, Amazon. And it was interesting. This was the first time we had heard this perspective. Rather than a fear of some of these entrants coming in and taking away business, some of these large health systems were looking at this almost as a partnership. Specifically, they were talking about Amazon and One Medical. Can we partner with them to where maybe they take the primary care appointments, the low margin work, and if we have a strong partnership, does that then feed us the high margin surgeries and ongoing care that our organization may need? And Amazon is going to be one of those companies that creates a great digital experience for a patient. We all experience that. I would wager that all of us have an Amazon Prime account and know how easy it is to get on and order something. Adam probably has purchased a few things just while standing there. What was that? Did you want just one? Okay. So the patient portal. One of the questions we asked patients in this study was, how often do you use your patient portal? We really wanted to understand how key of an element is the patient portal in an organization's digital strategy, and do patients even care? And as you look at the data here, it's kind of interesting that it almost falls into a story of thirds. You have about a third of patients over here in the blue that are, I would say, high users of the portal. These are likely your chronic patients that are in looking at test results regularly, maybe scheduling appointments or doing telehealth visits through their patient portal. Then you have this almost third of patients who don't even know their doctor has a portal, or they've never been in the portal. And then a third somewhere in the middle, quarterly to annually, kind of an as-needed basis. So what this tells us is the patient portal isn't the one-stop shop, the one solution that will meet all of the patient's needs. They're going to engage with an organization in a variety of ways. So if you're banking on the patient portal to be your only digital experience for the patient, it's probably not going to hit the mark completely. Anything you would add? Yes, and this is largely an ambulatory focused data set, so these are your primary care and specialty type visits. We also asked the patients, if you were to, they were able to self-select into one of these 3 buckets, what is your relationship with your doctor? Do you feel you have a collaborative relationship? Do you feel it's a reactive relationship, or completely detached? You have no relationship with your healthcare provider. A lot of this feeds into that high portal use, the collaborative relationship. But I find it really interesting when you start to look at the different demographics that drive this relationship. Look at some of the groups that were more likely to report a collaborative relationship with their doctor. These are your conditions, these specialties where you're going to have a high number of touch points with the doctor. They're going to be really invested in your care. Older patients feel like they had a better experience and a better relationship with their physician. You look at the groups over here that were on the opposite end. The younger patients, those that were attending an urgent care specialty, that are there just for a specific need, not an ongoing relationship. Every one of the questions that we asked in the survey, we have this type of deep demographic information. Let's talk about telehealth. When we presented this data a year ago, just before this survey was released, telehealth was still kind of just starting that decline in usage. it'll be interesting to watch this as it goes on, but patients really do demand or want to have a virtual care experience with their organization, especially for conditions, ongoing check-ins, things that can be done without an in-person visit. But we had asked patients, have you done a visit in the last year? And I'm not sure how we got 2% that weren't sure if they had a virtual visit or not. You either did or you didn't. But other than that, you basically have half of them that had, half of them that hadn't.
So I have a question.
Yeah.
Where was this population? Was it urban? Was it rural? Was it representative across demographic and geographic?
Yeah, we can, and we're happy to share the full study with all of you.
That would make
Because, so this 48 of the 50 states were represented. It's a pretty good mix of urban, suburban, rural. It's a little more than, I think it was about 60% female, 40% male. It does skew a little bit towards the white Caucasian, but there's a good mix of other races that participated. It's a relatively good cross-section, because this was turned on across physician groups all across the U.S. Yeah. Anything you would add? Actually, a great point there. I don't have a chart for this, but this group that hadn't participated in virtual visits, one of the questions we asked as a follow-up was, how likely are you to try virtual care in the future? And about 40% of respondents that hadn't had intentions to do that in the future. And some of the groups that showed higher rates were African Americans, Asians. Those are two that stick out off the top of my mind that were higher than their peers, percentage-wise. When we look at that other group, those that had done a virtual visit this last year, you have about 2/3 of respondents that are going to maintain their same pace or increase the pace of virtual care that they receive. So when we kind of triangulate these data points, half the industry has done it, that half is going to continue or increase, and those that hadn't, about half of them intend to try it. To us, that kind of tells us the patients have an appetite for virtual care, right? So as the organization, as the pandemic, what's it called? The public health emergency is coming to an end, and some of those rules may shift a little bit. I think it's really important for organizations to consider, how do you offer virtual care in a way that meets the patient need on an ongoing basis? Okay, I'm going to go quickly through these other slides to make sure we're on time. This was a follow-up question we asked about telehealth. Those that had done a visit and had rated it, their visit, they were dissatisfied, neutral, or very dissatisfied with their virtual care experience. What suggestions did they have for their organization? As you look at these are less about technology, a few of these, and more about just the process around the virtual visit. They want to understand what types of visits are appropriate for telehealth or not, rather than getting all the way to the point where you're receiving that care. I had an experience early on in the pandemic where I'd hurt my ankle and had a virtual visit, and he couldn't diagnose anything. He had a pretty good idea of what it was, but he had to send me to the urgent care to really get that taken care of. It would have been nice to know that ahead of time, because I was in a lot of pain. Tactical things like receiving the link prior to the visit, just the friction that causes with the patient, I think, is something that can relatively easily be addressed. I'll pause so you can get your picture before I move on. Okay. So we had asked the patients that participated, what have you done? And then what's most important for you to do going forward? And I just want to highlight a couple of areas where we saw some pretty big discrepancies. So we've pointed to this a couple times. Scheduling an appointment. Look at that big discrepancy between those that have experienced that and those that want that. Booking a flight to come to HIMSS. How easy was that process to get on to your Delta app, your United app, your American Airlines app, choose a seat you wanted, the time you wanted? It's a frictionless experience for the most part in other industries today. Can we get to that point in healthcare is a question I would pose. And I think we can. There's a lot of challenges. I don't want to make this sound easier than it really is. To standardize scheduling practices, to to get the physician buy-in. There's a lot of change management that needs to take place to roll out scheduling, but patients are demanding it, and they're going to start to vote with where they choose to receive care.
And because we know the lack of patient voice, because we know scheduling is such a priority, we're going to wrestle over that at our upcoming summit, because the technology's there and we know it's a priority for patients. So in November, we're having a patient and consumer innovation summit, and we're going to ask vendors and providers and patient advocates to help us figure that out a little bit. We love to wrestle over topics and not just lecture at our guests and say, healthcare's broken. But scheduling is one thing we're going to dive deep on. And that's on our website. We've got some info if people want to know about that summit. So
it's a nice change of pace to have the raspy voice after listening to me a little bit. Another area I'll point to, prescription refill requests. A lot of this is happening through the patient portal today, but certainly not enough to meet the patient demand. And I think organizations that are able to solve some of these relatively straightforward challenges are going to continue to retain patients. And then I want to show filling out a patient satisfaction survey. We're all patients, in addition to our roles in HIT. Nobody loves to fill out a survey, right? But can we create an ongoing real-time patient feedback process that helps the organization with service recovery? They want to create a good experience for their patients, but patients don't want to sit down and fill out a long CAP survey after an appointment. When they think about patient satisfaction surveys, that's what's coming to mind. There are a lot of organizations that are pivoting how they approach patient satisfaction measurement to do so in a more real-time way that allows them to more seamlessly meet the needs of the patient prior to the 2 weeks post-visit when there's really not anything they can do about it. Okay, we've talked about a lot of these things. I won't read this list to you. These are some findings that came out of this study. We'll preach this over and over and over again. Self-scheduling is a high demand area for patients. The technology is there. Now's the time to invest, and not only in the technology, but to invest in the change management to prepare your organization for that technology. Okay. Oh, sorry. Let me go back. You were about to take a picture. Yeah. So I talked about this one a little bit. It's more than just technology. It's the process, the environment that you're creating, that holistic experience that you're creating for a patient. You need to think through that end to end and not just throw a lot of technology at the patient that creates a confusing and disjointed experience for them. We talked about the patient portal. You've got that third of patients who never use the portal, a third that use it moderately. What other ways can you engage them? Through a seamless digital front door, through proactive push messaging, through many different other technology methods. The portal isn't the only solution to address a lot of that. Shameless plug for a podcast that Adam and I do. It's called Amplifying the Voice of the Patient, or Patient Voice Amplified is what we call it. You can find it on Spotify and YouTube. We interview a lot of leaders in the healthcare industry about how they approach care in a patient-centric way through technology use. And what? Yeah, we should have brought our stage prop, the megaphone. Well, we're happy to answer any questions.